Picture this. February 19th, 1994. A night that would forever haunt Riverside General Hospital. A woman walks into the emergency room, and within minutes, she becomes known as the Toxic Woman. Her name was Gloria Ramirez, a 31-year-old mother of two, suffering from late-stage cervical cancer. But no one, not even the doctors who fought to save her life, could have predicted the horror that was about to unfold. When Gloria was wheeled into the ER around 8:15 p.m., she was struggling to breathe, her heartbeat dangerously unstable. The staff rushed to stabilize high V's, oxygen, defibrillator pads, all standard procedure, but as soon as they got close, something felt terribly wrong. Nurse Susan Kane noticed a strange, oily sheen covering Gloria's skin, a glistening, almost chemical-like layer. Then, an odor began to fill the room. Not the usual smell of antiseptic or blood, but something sickly sweet, like garlic mixed with fruit and metal. Doctors glanced at each other, confused. Within moments, one by one, the staff began to collapse. Nurse Kane suddenly swayed, her vision blurring. A medical resident followed, vomiting and gasping for air. Even the trauma doctor treating Gloria lost consciousness. In less than 10 minutes, the ER looked like a war zone, with nurses and doctors passed out on the floor. An emergency protocol was activated, and the ER was evacuated. Gloria Ramirez was left nearly alone on her gurney, fighting for her life as the staff tried to regroup outside. By the time they returned, it was too late. Gloria was pronounced dead at 8:50 p.m., but the mystery was only just beginning. A hazmat team was called in. Samples were taken. Every test came back inconclusive. What had made the air so toxic? Why had multiple trained professionals collapsed after exposure to a single patient? The media exploded with theories. Some called her the Toxic Lady. Others believed it was a chemical accident, maybe caused by the hospital's disinfectants reacting with something on her body. But then a chilling detail emerged. Before coming to the hospital, Gloria had reportedly used dimethyl sulfide, or DMSO, a solvent once sold as a pain reliever. It's harmless on its own, but under the right conditions, high oxygen levels, medical treatments. An electric shock's DMSO can transform into dimethyl sulfate, a highly toxic gas. A gas that attacks the lungs, eyes, and nervous system, exactly what happened that night. It seemed impossible, yet the evidence lined up almost too perfectly. Gloria's autopsy showed nothing supernatural, no radiation, no poison. Just a woman's body ravaged by disease and perhaps a tragic chain reaction caused by desperation in chemistry. Even today, not everyone believes that explanation. Some say the DMSO theory was just a cover-up, that the hospital was hiding something, maybe a chemical leak, or even a government experiment gone wrong. We may never know for sure. What we do know is that one woman's death left an entire medical team traumatized, a hospital sealed in mystery, and the name Gloria Ramirez forever etched in the darkest corners of true crime and science history. Was she a victim of a freak chemical reaction, or something more sinister? Let me know what you think happened that night at Riverside General. If you enjoy stories like this, true, eerie, and real, hit that like button and subscribe. Thanks for watching.